Hello, this is Dr. Mohammad Athaullah, a senior consultant physician from Care Hospitals. Today I will tell you about a disease which has been considered extremely rare in the past, but which is not so rare, that is obstructive sleep apnea. So obstructive sleep apnea is nothing but a situation where the architecture of the throat is altered and patient will find difficulty in breathing during night time. So these patients are usually obese, where the body mass index can be very high, more than 25 or more than 30 or 28, number one. These patients have a thick neck, number two. These patients also have other comorbid conditions like hypertension and hypothyroidism in about 30 to 40% of the patients. And these patients are mostly obese. But we are now seeing some patients with obstructive sleep apnea who are even not so obese or lean also. So what are the basic symptoms of this sleep apnea, obstructive sleep apnea? The most important symptoms of obstructive sleep apnea are daytime sleepiness. The patient comes to the hospital, to the office, and you see that the patient is a little obese, and you ask the patient, do you sleep in the daytime? He says, yes sir, I sleep almost whenever I read a newspaper or watch a television, or even some people while driving also sleep. And this is extremely dangerous. I have many patients who have met with accidents and they are a threat to themselves as well as the people on the road. So this is an extremely important daytime sleepiness. Number two is, you ask the attendant or the spouse of the patient, is there any nighttime snoring? They invariably tell that, yes sir, my husband or my wife snores during the night time, and the snoring is so loud that nobody in the house can sleep. So this is the second important feature, apart from obesity, a thick neck, as well as hypertension and hypothyroidism. So you have to pick up these patients very early, because they can be a risk to themselves when they drive, and they can be risks to the people on the road. Now let us look at the treatment of obstructive sleep apnea. There is no medical therapy available for the treatment of sleep apnea these days. The only form of therapy available to us is the usage of auto CPAP or a BiPAP machine, which has to be put on the patient. It's like a mask, big mask, which has to be applied to the nose and mouth of the patient. And this BiPAP machine or auto CPAP machine delivers oxygen at a high pressure into the lungs, so that the saturations do not come down, and patient will have a good quality of life. Apart from this BiPAP machine and auto CPAP machine, the other important things which we have to address are the hypothyroidism, treat the hypothyroidism; hypertension, treat hypertension. If the patient has blood sugar levels, treat sugar levels. And most importantly, I would say, ask the patient to reduce the weight. Even 5% or 7% or even 10% of weight reduction will lead to substantial improvement in these patients. And if the patient is intelligent enough to lose a good quantity of weight, then he can be off the BiPAP or auto CPAP machine for a long time to come. So weight loss is extremely important by means of exercise or means of dietary modifications. Or now we have some drugs available. Some of the drugs are on the pipeline, which are going to be launched in the due course of time in India. You can use these medications and reduce the weight and have a good quality of life. Thank you very much.